Thank you everyone for joining us today for our first Autism Transitions Research Project, or ATRP Table Talk. Today we're discussing how to use big data to make sure autistic young adults have the same chances at good health and an easy time when they start their journey to adulthood. The Autism Transitions Research Project is a collective of researchers and stakeholders who are trying to fill the gaps in research about autistic youth as they transition into adulthood. We're looking at things like services, supports, and health. Our researchers today are looking at big sets of data or information collected through programs like Medicaid, for instance, to understand this transition better and to work towards making sure everyone has equal access to good health and services that best support a young adult's transition journey. We know that the data collection, and sometimes the research isn't perfect. So today we are going to talk about things like sharing this data with people who can have impact and people who can make a difference, otherwise known as data democracy. We're also trying to make sure we're responsible in our work to help autistic young adults as they become adults. My name is Kyle Shavasta. I am the Assistant Director of ATRP at the Policy and Analytics Center at the A.J. Drexel Autism Institute. This project is overseen by our PI, Lindsay Shea, who's with us today. A little bit about me real quick. I'm a social worker and autistic self-advocate. And with me, our conversation facilitators today are Eddie Williams from Boston College, Christy Anderson from Florida State University, Teal Benavides from Augustus University, and Jessica Rast, Anne Rue, and Wei Song, also from the A.J. Drexel Autism Institute. Before I hand it over to our moderator, Eddie, just want to go over some house rules. To ask a question of a panelist, please write your questions in the Q&A box. We have planned questions, but we'll have a brief Q&A that will be facilitated after the roundtable. If you are experiencing technical difficulties, please write your comment in the chat box, and me, will respond to you directly. Closed captioning is available, and with the speaker's consent, we are recording today's conversation. So without further ado, I would like to hand it over to you, Eddie.
Thank you, Kyle. Hello, everyone. Thank you all for joining us today. I think we have a really good conversation. Here's some great information from some great scholars doing incredible work. So as Kyle said, my name is Eddie Williams. I'm an assistant professor at Boston College School of Social Work, where my work focuses on Black autistic youth, mental health help-seeking behaviors, and intervention development around help-seeking and mental health, primarily focusing on depression. And I am new to big data, honestly. Over the past year or two, I've been trying to get a better understanding myself. So I'm really excited to hear about the work that the scholars before you are going to talk about, and the work that they're doing, as well as hear from some of you all about the work that you're doing and hoping to see come forward. So just to start off, start with some basic questions, and I guess we should ask the panelists to also, as they speak, to introduce themselves just briefly as they answer the questions. And then, as Kyle said, if you have questions, please feel free to throw them in the chat or the Q&A, and we'll try to get to them as we can. So I guess I should call on people. I guess I'll go in the order people are on my screen. Let's start with Jessica. Could you tell us a little bit about some of the big data you're currently working with, and maybe describe a time you saw a data discovery that you felt had an important impact on the conversation? I'm reading these questions.
Yeah, that's great. Thanks. I'd love to start. So my name is Jessica, and I work at the Autism Institute. I am a data scientist and a data analyst to some degree here. My educational background is in epidemiology, so I really do like big data a lot and data in general. On the team, I use a lot of our big data sources to look at mostly focusing on health, but all areas of life, looking at what our data can tell us about what people are experiencing. And a lot of my focus is on services, specifically the health system and the mental health systems. What we might not be doing great, what might be doing better, and what holes there are and how we can fix those. So really focusing on how we can use our big data to inform those sorts of questions. So I think you asked about a discovery I had that had an impact on something. Is that the question?
Yeah, sorry, I kind of
Eddie, yeah.
started over there.
Oh, no, you didn't.
But
You
yeah,
just
yeah,
anyway, yeah.
describe
So
the time. Yeah, so go ahead.
um one of the first times that I remember this happening was in my work here at the Autism Institute. It was many years ago. It was in 2016 now. So the GAO, the Government Accountability Office, released a report to Congress about service needs in the transition to adulthood for autistic people. And I had been lucky enough to work with some people on this call, and Paul Shattuck, who was working with us at that time. And that report was talking to Congress about the needs at this time, and it can be used to prioritize funding and policies and all this sort of big work that we try to influence. And it cited our stuff, and it was really exciting. It was like the first time that I had ever seen this happen. And I was pretty new to research at that time. And I just thought it was amazing that this was, our work was informing something that could really, in my opinion, make an impact. I've been working long enough to know that it's not quite that easy, but it was the first thing that I saw that had really, the potential. And I thought that was really awesome. If anyone's interested, I can definitely share the link to the report, but it's probably a little dated at this time, but that's one of the first things that I saw. And it was really informed by some of our research articles and our National Autism Indicators reports. And it was just very cool to see.
Thank you so much for sharing that. It's exciting information. Data is coming out from Drexel and the National Autism Indicator report, which I'm using quite a bit recently. So I'm excited to see more of what comes from that. Let's go to who's next on my screen. Anne?
Hi, everybody. I'm Anne Rue. I'm a research scientist at the Policy Analytics Center at Drexel. And my work focuses a lot on transition, and also I'm interested in employment. And when I think about data and how we use data, we are talked about the National Autism Indicators reports, which I kind of think of as big data with a lowercase b. It's looking at national surveys that have been conducted that also have a marker of people who are on the autism spectrum, so that we can take that data and extract it and start to figure out really answers to basic questions about things like percentage of people who are employed or people who have access to healthcare, what are their service needs, like all of these foundational level questions. And so our work really started in that area, but has morphed into what I would call big data with a huge B. And that is more these gigantic administrative data sets that come from vocational rehab, from Medicaid, Medicare, that are really enabling us to look at a larger population of autistic people and really understand more about segments of those populations by race, ethnicity, by sexual orientation and gender identity, by specific types of health needs, things like that. And I guess a more recent example of where that has made an impact, I think, is our effort to look at capacity to provide employment services to autistic people. We recently published an article in the Milbank Quarterly, in which we looked at the numbers of autistic people who are receiving vocational rehabilitation services and numbers who are receiving employment services through home and community-based services funded by Medicaid. And when we added up the number of people who were actually getting services, and we estimated the proportion of the population we thought likely needed services, we determined that only about 1% of people are actually getting services. And so I think we were all a little shocked by that number. It has definitely got some attention, like, numbers really drive some action. And so I've recently had some people reach out from the Autism Society of America, who are doing like kind of a policy roundtable on this and trying to come up with and brainstorm about ways that they might be able to use data like that to generate some action and come up with a plan. So that is super exciting to see anytime that the efforts that we make with our data get out and people actually uptake that and start thinking about it. That's huge. So
Thank you so much. Again, incredible work. It's exciting to hear everything that you all are doing and to hear about the unique forms of data that you all are using and how you're utilizing it. So thank you so much. Next up, Wei.
Hi everyone. My name is Wei. I'm also a research scientist here at Drexel University. I think my main research interest is how to investigate how autistic adults participate in the community and their general experiences in the community. So I'm like, for instance, some of my recent work related to look at how community participation in different type of activities was associated with individual health, physical health, and mental health. And some other interests related to transition age use are adverse childhood experiences. So those are some of my current focuses. And in terms of data discovery, I can't speak to my own work, but I do want to concur what Anne said about their work. And one example that I often notice is, as a fellow researcher, I often notice that when it comes to employment work, Anne's work is often cited in those literature, which I'm sure that the data, the results from those reports and articles inspire a lot of other researchers' work and conversations around employment. That's my experience. Thanks.
Thank you so much. Incredible work. Christy.
Hi, my name is Christy Anderson. I'm an assistant professor in the College of Social Work at Florida State University. And I have also spent 7 years with this team at Drexel. So my work really focuses on understanding how poverty and its cofactors impact health equity outcomes for people on the autism spectrum. So really trying to understand how policies and programs outside of the healthcare system, like food stamps and Social Security, how those can be better improved in terms of accessibility and reach, so people on the autism spectrum can receive the safety net benefits that they may need. In terms of the types of data I use, so I've used large administrative data sets, like the Social Security administrative data sets, which had national caseloads of adults with autism who received SSI. I've worked with also a lot of national surveys as well. And I think a finding, so I think what's really nice about big data is it really speaks to the breadth of a problem or an issue that I think really could resonate with policymakers and resonate with people and stakeholders who might have the resources to better improve social policies. So I would say that my really interesting finding was when I looked at Social Security administrative data to examine SSI caseload growth for people on the autism spectrum. And what we found is that a number of adolescents and adults with autism who are entering SSI is growing at a disproportionate rate relative to other groups, and that the majority of people entering these programs are between 18 to 25. So it really kind of highlighting the importance of the transition period in terms of financial security and economic independence, and the role that social policies can play in facilitating that. So that's kind of my passion moving forward, is understanding that better.
Nice. Thank you so much. Yeah, the administrative data is incredible, and I've had a chance to speak with quite a few of the people on the panel already about their work, just in one-on-one conversations and hearing the work you're all doing. So, again, great work. Thank you. Teal.
Hi, everyone. My name is Teal Benavides. I'm an associate professor at the Institute of Public and Preventive Health at Augusta University, and I am really thrilled to partner with all of you who are on this panel in many different ways. The work that I do aims to understand priorities that autistic people have for health outcomes and everyday life, and as well as care partners and their priorities, and then translate that into the use of large-scale data to inform what we know about those priorities. And so, for example, understanding areas of priority like mental health, access to services, and gender and reproductive health are things that the autism community has shared are important areas. And so when thinking about those priority areas, and I would highlight what everyone else has shared, that publications certainly have a huge impact, and the work that the AJ Drexel Autism Institute does around all of the briefs and the reports, the indicator reports are huge. But I also want to highlight that conversations with partners are one area where I see a lot of excitement and growth. So the discovery that I'd like to share is related to gender and sexual reproductive health. So in looking at Medicare and Medicaid data to understand HIV diagnosis, testing, and receipt of antiretroviral treatment for those who are diagnosed with HIV, we found some significant racial and ethnic disparities. And in partnering with clinicians and clinics that provide reproductive health care, we're starting to have some really cool conversations about what kind of preventive care options need to be made available to autistic individuals. How can we think differently about the environment and the way in which treatments are being offered? So the standard of care, for example, are injectables, long-lasting injectables. And for people who might have sensory or may have an injection adverse experience, injectables are not a preferred way of treatment. And so the discoveries, I think, are really impacted by those conversations that I enjoy having with the autism community, people living with the experience, as well as the clinicians, the care partners, and others that are supporting these outcomes. So conversations with HIV clinics, OBGYNs, and others to really expand what we see from big data into everyday life. And that's the kind of discovery work that I really find most impactful. It's not always in the publications, but it's in those everyday conversations and relationships that come out of the work and how it grows from there.
Yeah, thank you so much, too. We actually have a question from an audience member for Christy. It says, the autism rate of SSI for 18 to 25-year-olds is what would you say the average is?
Yes, I'm happy to share the manuscript out as well. So it's really what we found is that I think it was like 115,000 adults with autism ages 18 to 65 were entering SSI for the first time, meaning they didn't receive benefits as a child. Of all of those new awardees or people entering the program, 9 out of 10 of them were between 18 to 25, which is a lot higher than we see in other disability groups. Typically, they enter SSI in middle to late adulthood, like in their 30s. I don't know if that answers your question, but I'm happy to share the papers as well, if you're interested.
Thank you so much for answering that, Christy. So I don't know if anybody is like me on the panel or even the audience. My first kind of intro to big data, hearing the term big data was intimidating a little bit. Like, you know, like statistics or anything that you hear first off is a little intimidating. Like, what do I do? And big data just sounds like a big overhaul or a big thing to take on. For the panel, how would you describe, what would you say big data is? When you think of big data, what would you say? I don't know if it.
I'll chime in here. I think there's this way that big data is talked about. There's a couple of parameters, the 4 V's, the 5 V's, the 6 V's, volume, veracity. There's a way that big data is talked about that has a lot of technical language to it. And in fact, in one of the data processing facilities that we have at Drexel, we have colleagues in engineering who are using similar big data processing for amazingly different big data purposes, looking at particle collisions and all sorts of mathematical structural equation processes that require large processing capacity. And so, you know, I think big data can mean many, many different things. In the field of autism research, and specific to transition age youth, I think that the goal of what we've put forward here in the Autism Transitions Research Project is that we seek to identify sources where we can look at large groups of autistic transition age youth and understand their experiences. That many of us who are interacting with communities and with autistic individuals directly hear that things are not going well and have been hearing this for 20, 30, plus years, often even beyond that. And the question is, how often is that happening? And in what ways is it not going well? Is it the front door isn't working? People can't get access? Is it that even once you're in a system and able to get services, the services themselves aren't meeting your needs? And so our, I think, collective approach on big data is focused on the idea of many people, where we can look at subgroups, which requires large sample sizes to be able to run those statistical tests. There's also, I think that if there's one place that we, or at least I, have definitely not focused, there are many different ways that we can think about big data with the overarching goal that Kyle presented at the very beginning of ATRP. So to understand health experiences, there are many autistic transition age youth who are, for example, enrolled in private health insurance. I know for me, it's felt important throughout the entirety of my career to focus on Medicaid as a public health insurer, because that is the insurer of last resort. And that doesn't mean that the experiences of autistic transition age youth in private insurance aren't important. They're incredibly important. And that there's a tremendous amount of work and some excellent studies focused on autistic transition age youth in that big data set underway right now. I think for me, it feels like our big data definition being centered on aiming for equitable approaches and opportunities shapes my definition of big data differently. And that is informing ATRP, not the only input into ATRP, but is one way that I really seek to prioritize my own big data work.
Thank you so much for that, Lindsay. So yeah, I mean, I think again, I think the term sometimes big data can be intimidating, but hearing that there's so many different type of sources out there that can be tapped into, and the way it can be used to really make research more equitable, and that the work that we do more equitable is great. I'm curious for the panel if there's any other forms of big data that they interact with, everyday data that they interact with, or would like to, to utilize in the future. I know, Lindsay, you talked a little bit about Medicaid and private insurance data. Was there other opportunities to utilize big data that exist out there?
I'll share
I
that.
think,
Go ahead.
Just because my focus is on these safety net programs like food stamps and Social Security, to analyze and really understand comprehensively the package of like policies and programs that transition age youth are accessing, it requires us to be merging these data sets across multiple institutions and agencies. And right now that's just not available. So it's hard to find. We have like snippets of the circumstances surrounding a person or a case, but we don't really have a comprehensive understanding of all the types of services that are either being accessed or not. So I think for me, opportunities to merge administrative data sets across programs would be a vital next step. Yeah.
I was also going to add that I think overcoming people's beliefs about who might be using different systems or supports is an important aspect of big data. So about 10 years ago, when I started using Medicare claims to understand autistic adults' experiences and health outcomes, and was finding many transition age youth who were recipients of Medicare, there was a lot of disbelief that there would be transition age youth who were recipients of Medicare as a form of health insurance. And mainly that's because in our society, we think of Medicare as providing health insurance to people age 65 and older. But in the case of many transition age youth, as Christy has noted, many are going through the Social Security disability insurance process, and you can receive Medicare after a 2-year waiting period if you meet other specific eligibility criteria. And so big data is thinking outside of the box sometimes about where you might be able to understand people's experiences and shed light on those areas where the data can be harnessed to promote a better understanding of the big picture. As Lindsay mentioned, you know, there's private data, health insurance data, there's Medicaid data, and then there's also Medicare data. And as Christy mentioned, understanding how all of those things intersect with data sources that she's using, as well as other social determinants of health, the environment in which people live and grow up and work are incredibly important. And we just don't have a comprehensive picture where there's a single big data source. We sort of have to think creatively about where people are and maybe overcome some disbelief about whether or not people are in certain systems or not.
I'm sort of wondering, Eddie, if you're open to it. Asking you, as someone who's been learning more about big data recently, and for many of us who follow your work and are very informed about how we might think about big data approaches, by work that lots of other people are generating that may not use big data, do you have any, I guess, priorities in terms of either, you know, what you've seen out there in the big data universe, or ways that you would prioritize the use of big data that would be interesting for you?
Oh, that's a great question. I get to be a panelist today.
Sorry,
No,
that.
I mean, there's a few different things. I think as I'm learning and becoming more aware of what's out there, what people are currently using, the first part is also thinking about how identity is being developed or viewed in these data sets. So very often we don't have as much control over how the data set is organized, what questions are asked. You know, we're using Medicaid data or something like that, or something that's publicly available. You know, we're limited by that, but using the imagination to really dig into identity has been a unique experience. So trying to understand if someone has multiple racial identities, at what point, how do we code that data, that identity? How do we find data that gets into very personalized experiences of like racism and discrimination, and can we figure out ways to merge that data together to make sense of that? Another thing I'll say is, as someone who fancies himself a mixed methodologist more than anything, is figuring out how do we take these large data sets that exist and merge that with qualitative work or work that gets into the deeper context of people's lived experiences. And I think there's a lot of room for it. We just haven't traditionally, people have kind of been siloed. Like, I do this big data work and this is what I do, versus I do this very in-depth qualitative work with small ends, and this is what I do. And I think, my time at ATRP, I've had the chance to work with many of you all on here, and do just that. Like, we have this large data, but we're also we have this qualitative data that we really want to dig into and try to contextualize these experiences. So that's a way I see big data kind of. That's my hope for the future, is that we can think more creatively about identity and then also contextualize experiences. And then the other part is, I didn't realize things like social media data, right? Things like that. I didn't realize that's big data, right? We can scrape the metaverse, I guess, and get information from there. I'm part of several like Black fathers groups, Black parents groups, and there are hundreds, if not thousands, of parents and fathers on there that will answer questions and have done surveys and are sharing their experiences on there that can be utilized. Recently, I saw a group of Black fathers and a group of men talk about their child who's autistic and their experiences with them. And that's sitting there on this Facebook group, and there's 100 Black men on here talking about it, and dozens of more jumping in and replying and things like that. And I would imagine that more data exists in other spaces online. And so not my skill set yet, but I hope to someday learn how to, scrape that data and dig in and really build from that. So I think there's a lot of room for it. And I think having space like this to really talk about how big data can be utilized, how we can make it more equitable, and how we can build equitable research from it. I hope that answers your question.
No, that's wonderful. I mean, I think in terms of defining big data, there's some ways that we have to start almost with what it's not. And you just articulated what is among the most important limitations of big data, in that it doesn't have measurable constructs or operationalization of critical concepts for how we form research questions or measure them. So I thought that was it's so much better than like the 6 V's of veracity. Like, I think, Eddie, what you just articulated is far more useful, I hope, for an audience that might be thinking about these research questions. We have data processing folks at your ready to work with you, Eddie. So keep us posted on that. Happy to work together.
For sure. Sure. And I think you were going to say something a second ago, and then we have a couple of questions from the audience.
I was just going to say something similar to what you brought up, Eddie, about social media, that to me, I'm newer to big data also, but I think about big data as sort of everyday, everywhere type of data also. So the weather, we've all been talking more about climate change and the impact upon people with developmental disabilities. And I think there are a ton of just endless opportunities to think about how we can pair up that everyday data about things like the weather to look at specific needs of autistic people. So the people that live in areas that have unpredictably hot weather or more natural disasters, how does that impact mental health visits and physical health, and all the places that we can look in our data sets to determine the impacts that might be more specific to people with certain types of disabilities. So that's I think is super exciting. Like you talked about, it's enabling new ways for us to think outside the box to discover people's needs and come up with solutions.
Thank you so much for that. That's exactly it. I think there's so many. I mean, we live in a time where there's so much happening online and so many ways to connect that we really are surrounded by big data every day that we can possibly tap into and reach into, and it really answers some very unique and important questions. So we have I'll start with this. This question is directed towards Teal. How can big data researchers incorporate autistic voices in driving the priorities and direction of the big data research?
That's a great question. And I think there are many on this panel who could also answer that. So I invite others to chime in. And that work is being done here at ATRP, really. All of you who are in the audience are part of this community. I think we sometimes, as Eddie mentioned, need to go between different research approaches to engage partners who have lived experiences, a variety of lived experiences, and do that co-developed and co-partnered work to understand what priorities are. A lot of that work does not happen in the big data area, but is essential for driving next steps that could inform systems change that the big data are so useful for. And so I think the question, Eddie, was how can we do that? I think we need to be combining research approaches. So epidemiology plus community partnered research to really get at what are the priorities? How can we ask questions that answer things that are important? Go to the big data, ask those questions, come back and say, this is what the big data showed us. What do you think this means? How do you think we should pursue next steps? And I think that is one way forward. And an example of what we're doing in that sphere is for example, Medicare and Medicaid data have information about people who identify as Pacific Islander or what Medicare and Medicaid label as Native American. And so instead of just publishing on that and saying, this is what the data show, members of this panel and others have come together to say, in collaboration with tribal partners, groups that we're trying to work with, it's not, a done deal yet. Anyone is welcome to join us in this initiative. What are the important priorities that tribal communities have, Native American communities and nations have, Pacific Islander communities have, and what should be asked of this data before the data are queried, right? So those are some examples of ways that we can slow down our processes to say, what does the community really want and need? And then go into the data and answer those. I don't know if I answered the question. Anyone else, please chime in.
It's been really interesting to work on exactly this question, I think, together. There's a way that I think even those of us using these data every day or who have experience using them still look at the numbers and say, like, what does this mean? And really needing engagement to figure that out together. because otherwise we will be doing a serious disservice to the data and to the communities and the people whose numbers are in every spreadsheet, in every data point that we're looking at. We've started to think about how we move our data into pictures, whether those are in dashboards or some other infographic flow. And I think we are fortunate on this team to have a graphic designer and have people who are, familiar with working with dashboard software to create options, but that has not given us all the answers. I think we still have a long way to go to figure out how we take these data and put them into usable forms for anybody who might be willing to help us understand what's going on, much in the same way that I would need those researchers doing particle explosions in our data at Drexel in our engineering school. I would need them to break that down for me and in very small, teeny tiny chunks and describe it and help me understand what's going on and to seek those voices in return. So I think we've been very fortunate for the partnerships and the opportunities to kickstart this work, but we have a long way to go. And any ways that people are willing to partner with us or have conversations about that, we welcome, will prioritize, and are ready to invest in how we can make that a part of how we move forward.
I would also argue beyond establishing community partnerships, we as researchers in our own siloed selves need to make a proactive effort to keep up with trends, because language and identity and grassroots movements, they're dynamic, right? And these researchers are really developing the constructs and the measures in a lot of these big databases and how we're categorizing race or sex or gender. And so I think just being mindful and quote, up to date, with what is going on in the larger culture is really pivotal and important. And as consumers of research, having that eye and understanding, that these are derived typically from researchers. So there's limitations, but that in itself, I think, can go a long way as well. Yeah.
I just wanted to add that I think it's hard to have a conversation about big data without thinking about the sources of where our funding for exploring that data come from. And in an ideal world, we would have ability to start the conversation like Teal is talking about and query communities about what their needs are, and then move into answering those questions with our big data sets, and then be able to disseminate the findings in a way that people can understand. So it really mechanisms that allow us to involve the community from the very beginning to the very end of the process with their voices informing every step of the way. There was a call yesterday in the new IACC strategic plan to guide autism research funding is now available. And one of the main focuses that I saw in reading it is a call for more funding directed towards services research. So when we're thinking about that and how we can incorporate big data into calls like that, I think I'm hopeful that we will also see some parallel movement where we have more funding sources that allow us to meaningfully involve community members from the beginning to the end of the process.
Thank you so much for all that. And I think we have a couple questions coming in, but just to keep us on schedule, I want to ask one more question kind of just off of that, and then I'll go back to some of the Q&A stuff here. But thinking about how we are taking our findings from big data and just the data itself and making it more useful and I'll say available for the public. Could you all, I think Jessica and you all kind of talked about this a little bit already with the National Autism Indicators Report, but can you talk a little bit about data democracy and have you seen data democracy, first off, what it is, and then have you seen data democracy in action in your transition research or elsewhere?
So I looked into this a little bit, Eddie, because I've been curious. We've been starting to write more about data democracy in our policy impact project that we engage in. And it's easy to find if you just Google data democracy, data democratization, answers that come from the business community. So ways that this gigantic milieu of all the data that's being collected about how is that made available even within corporations for people to be able to analyze, and then how does privacy intersect with that? All of those conversations we hear in the media, and those are really important. I think from our lens as public health researchers, social workers, social scientists, we also think about how data is made accessible and understandable to community members. And it really turns into more of a conversation about data justice. So this intersection between the data we collect and how it is used to improve communities and to answer questions that are meaningful for their lives. I think that's what we're striving to do with our lens on data democracy, is to make sure that people are involved in these decisions, that they have access to the data that they have really provided to understand what the needs of their community are. And then as scientists, we're then producing information in a way that people can understand and use to advocate for their needs. So I think from our lens, it's data democracy is definitely that social justice piece woven into data use.
Yeah, I agree. And I just to restate it, I often think of it as two pieces. So can you physically access the data? And then the second piece is the data understandable? Is it in a form or whatever is used of the data? Is it in a format that's understandable, that's approachable? And then it's the responsibility of the person who either created the data or created the products of the data to provide the context and the information that makes it so that it's understandable and usable. And I think we really strive to do both of those things. We do hold some data at the Autism Institute, but for the most part, we use available data that is from another source. Sometimes it's publicly available, sometimes it's something we've purchased, but we really do strive to make it an accessible product. One of our initiatives that we do is the National Autism Data Center. We put out those indicators reports that we've talked about a few times. We've been working hard to try to add more content that's usable by different types of stakeholders, fact sheets, interactive dashboards, shorter form reports, policy briefs, things that take these data bites, add context to them, discuss the strengths and limitations of what we found, give some information on what we think it means and how it could be usable, and then hope that people from there can use that information, have learned a little bit more about the data and can make it usable. One of my sources of inspiration is the Data Resource Center for Child and Adolescent Health, which is one of the holders of the National Survey of Children's Health, which is one of my pet big data sources, I guess. It's just the National Survey of Child Health and Healthcare. I'll paste it in. I think they actually do a great job of doing some of the data democracy things that we've talked about. They make their data available. They have reports to help people understand it. They give statistics out there that people can use to inform their work. And it's definitely one of my inspirations for moving our work forward. I'll just post that in the chat if anyone wants to check it out. And then you can access the data yourself. So I have assisted in some data democracy today.
Thank you for that. And thank you for sharing those in the chat as well. So kind of spinning off of the question, something you said, you mentioned like other stakeholders being able to utilize this data and things like that. Besides researchers, who else do you think could benefit from understanding big data that you look at regularly? And what are some ways that non-researchers can use big data or important data discoveries to make autistic people's lives better?
I can start, but everybody, I think that me and a lot of the people here, a lot of the panelists here are like the beginning of the data pipeline. And we really hope that people who are actually involved in making decisions, making policies, designing programs, that they will use this information to try to make the best of whatever it is they're trying to do. We do a lot of our work trying to target strengths and weaknesses of service systems or big gaps, things that are going well sometimes. So using the information that we produce that really targets those specific areas to say, hey, there's some evidence that these are the things that might be helping people, and putting those into action. And especially me, I'm probably one of the people that does it the most. I really am deep into the research and the data part. And I have a little bit less of a bridge than a lot of my other team members have to those sort of implementation steps. So I can speak most to the limitations of what I do. I know other people on the team do more implementation or are closer to that than I am, but everybody should be involved.
As a social work professor, we teach our undergrads and our master's students how to interpret graphs and platforms at the most basic level. Because really, from my perspective, what this data can do is it can help to inform professionals about new initiatives that they should support and what they should launch. It provides important benchmark statistics if they want to provide context in a grant application for a new funding program. And it really just helps to contextualize how best to, provide services and individualized services if needed, and understand how policies and programs might be impacting daily lives. But at the end of the day, I really just think it's about, it's a good way to also garner money because you're speaking to need or your strengths or weaknesses when you have these large population-based estimates of food insecurity or whatever it might be. Yeah.
I think John put a question in the chat earlier. John is a member of our ATRP Community Advisory Board that really gives an example, I think, of how people can use big data. So I believe he asked a question that gets at the heart of it, why is it that some people get funneled into services right as they're transitioning from high school and other people don't? What is it that makes some special educators more knowledgeable maybe about resources that need to be provided and connect people with VR or SSI, and then other families and young adults don't get access to that information? So as much as we're able to query the data and start to find answers to things like that, I think people who are in roles like John as an advocate, as a researcher, as people who interact with policy folks, these are the kinds of critical questions that people can really use that information to drive local and state answers, and to ask more questions at the local and state level based on information that we're putting out, bigger statistics, but how does it pare down to where you live? So
I also just wanted to highlight a study that was recently funded that Dr. Song is leading that's actually going to generate some big data by virtue of looking at individuals and their movements over time. So using GPS to gather many, many data points about how people move about their communities. And that's pretty unique because usually our data are incoming from other sources. But Dr. Song is really leading the way here in terms of how we can also work directly with people to both do some of that primary data collection and to get big data too. So I'm not sure, Dr. Song, if you wanted to talk briefly about that study and your training and the ways that you think about this application of big data as well.
Thanks, Lindsay. I appreciate you brought that up. When we talked about the type of big data, I thought about that kind of how we collected the data and what type of data we can collect. And yeah, then that comes to my mind is partially we have technologies, we have different tools that we can collect like daily momentary data from individuals if they're willing to give us that information. And that is very informative and can have an overall more comprehensive picture of that individual's perspective and also experiences at a daily basis. And we hope that this kind of information could help, self-advocate or community service agencies and give them some knowledge about how the autistic adults going on outside in the community, what they do and what kind of environment could support them better, their social and physical environment. So yeah, that's the so we also hope that there's some multiple collaborators, around this project, because one perspective of how you look at mobility and participation is different from also the people with lived experiences, and also the researchers from other disciplines. So there's hopefully that's another goal that could be achieved here in this using this project. So yeah, that's kind of like, oh, this is a great opportunity for me to give an overview of the project, and I appreciate the opportunity here. Thanks.
Thank you for that. We have another question from the audience. Says, right now you sound like you're using big data for descriptive purposes. When do you foresee moving into developing simulations that we can use to create service systems that satisfy the needs of unique groups of autistic individuals?
Yep, this is the question. Working on it, and excellent question. And I think this is poignant for this moment and where we are with our use of big data for ATRP and other projects as well, in terms of a drumbeat that's getting louder around, in addition to pointing to where things are not going well, start pointing to where things can go right and how we can target improvements. And I think there are members of this group that have catalyzed, pushed, spurred conversations in that direction. Teal, I think you've been an inspirational source of that for me. And I think that is where we need to move next. It comes with a lot of nuance. When we're looking at Medicaid and Medicare, there are federal implications, and then there's state level variation in Medicaid. And then you have groups that are looking at different programs, and they have all different rules. So, I think it's a big question. We need to start somewhere. We have begun to dig in this area around Medicaid, home and community-based service waivers, in terms of where are things going well. And I think that work is promising in how we can move forward. But I could rattle off for you at least 15 to 20 limitations of that work and problems with how that is not going to be the end-all be-all solution of system reform for autistic transition age youth, or probably any group. So I think that I value the question. It is a driving force of where I hope we are headed, and need to continue to have more emphasis and welcome and partnership from you and from anyone here on this panel or in the audience today and beyond, wherever this recording may land eventually, to have these conversations. We are not the only ones asking this conversation. There's a whole array of health policy researchers, analysts across many different diagnostic groups and elements of system change, whether it's Medicaid system researchers or people looking at diabetes or other conditions, who have sought a solutions-oriented approach to system reform. And so I think that, part of what we need to do is stay in tune with how their methodologic advancements are happening so that we can deploy them here too. Fingers crossed. We also need funding to do that. And I think part of the recent IACC report and what we're continuing to see is that, the services landscape is not as well funded as some of the other areas of autism research. And so that's an area of needed attention, I think, as well. Ideally, each of us here on this panel, each of you as audience members, would have multiple opportunities to be asking that very question and pursuing it.
Thank you so much.
I'd like to add, can I add something, Eddie? Do we have time for a quick add-on to what Lindsay shared? I was going to suggest too that I think Lindsay, you highlighted partnerships, and I just want to emphasize partnerships because there are some areas of knowledge or other professional experience that could be helpful here. So for example, machine learning and thinking about machine learning for predictive capabilities, like can we be harnessing big data to predict who might be at risk for suicidal ideation or behaviors using historical data, but that takes a machine learning approach that requires some expertise and other collaboration. So establishing partnerships with folks that have other interests and expertise is critical to the kind of work that the person who asked that question emphasized. So partnerships, identifying others who have expertise in other areas like machine learning would be critical, I think, to do those types of questions.
Sorry, I don't know whether there's another time. I just want to saying that descriptive statistics can be valuable in a lot of cases. I feel like descriptives is easy to understand and it can deliver a lot of information that people don't pay attention to. When you point it could point a direction when a lot of times the solutions are out there. We don't pay attention to them or we don't know where to look. And a lot of times, the easy statistic can point it out there and allocate effort to those resources and places. So I just want to point out, hopefully that descriptive statistics are not undervalued, and I still realize the importance of doing the big data algorithm and to generate bigger system change is important as well. Thanks.
Yeah, thank you all so much. So we just have like a couple minutes left, and so I'll leave with a kind of a question to the audience that they can throw in the chat quickly, or jump in and chime. I'm not sure if they have ability to jump in and talk, but for the audience, are you seeing big data being used in other areas that we at ATRP can replicate in our work? I think it's important to think about what you all have access to and what you all are doing or seeing, so that we can make sure that we're doing this work to the best of our abilities. And then also, in this last 2 minutes so we have, feel free to throw any questions in the chat or in the Q&A that we can answer quickly. I'm sorry not to rush anybody. I feel like I just rushed everyone, but I want to respect everyone's time as much as possible.
And just to kind of get everyone ready to answer this question, I'll chime in if that's okay. Not so much how people are using big data, but how people are disseminating data. I have seen really interesting ways that people have shared data or data sets visually through the use of not just traditional data visualizations, but art. I brought this up many times. I think art can speak many different languages and to many different people. And I think, Teal and I actually had this conversation the other day. We need to be thinking about how we share our work and how, our work is speaking to people. And I think non-traditional methods are really important. So, art or poetry or performance even could be ways that data is shared with communities or stories are being told by and for communities.
I don't know, how do you want to have people send out emails later on, as we're kind of like down to, I think we just hit 1 o'clock now, to follow up on this question, just so we can.
Absolutely. I'm going to put the ATRP email in the chat for everyone who wants to reach out with any further questions. And please feel free to visit us at atrproject.org. I'm going to put that in the chat as well. I'm going to share it with everyone and not just Eddie, as I just did. There we go. Here's the website. And here is our email.
Thank you all so much for your time, your expertise, and sharing the projects and things that you're working on and our hopes and goals for the future. with big data and autism transition research. Thank you all for the audience that are still left. I see people are kind of jumping off, but thank you again, and feel free to reach out to each of us with questions or suggestions, ideas.
Thank you, Eddie, for moderating. Thank you for coordinating all of us. Appreciate it.